We want to welcome you to Q&A with Doctors A and J, brought to you by Alterman and Johnson, Family Chiropractors. Hello everybody, I'm Dr. Franca Alterman with Alterman and Johnson Family Chiropractors. In today's episode of Q&A with Doctors A and J, we continue to bring you what we consider to be some of the most relevant elements of what we call the chiropractic lifestyle. This will be to help you support your body and your health and well-being through this really trying time that we're going through. Our guest today is none other than Kelly Googe. Kelly is a local birth doula, a childbirth educator, and a lactation counselor. Hello, Kelly.
Hello, Dr. Alterman.
I'm so glad that you are able to join us today, and we're going to have a session where we can hopefully bring some much needed information to some of our breastfeeding mamas in Northeast Florida.
Well, thank you so much for having me on.
This is awesome. Thank you for being here. So I'm going to just start by asking you some personal questions so that people get to know a little bit more about who you are. And rather than asking you your training, I'm sure that you went through certifications and all of that, yeah. Of course we know. More, I would like for you to give us a little insight in your heart. What made you be the passionate birth worker and baby helper that you are? What inspired you to do this?
After the birth of my second child, my midwife said to me, Kelly, you need to be teaching people how to do this. And I was already a teacher at that time, and I stepped into the birth world as a childbirth educator and lactation counselor and breastfeeding educator. And 17 years ago, I stepped away from teaching full-time to do this full-time. So after 26 years, being exposed to the birth world, it just continues to fuel my passion for helping moms and babies succeed in everything from, their birth plans to the way they are heard and empowered. Empowering women is so important, and trying to reach their breastfeeding goals, however that looks. Breastfeeding has 1,000 faces. So I always want to make sure that I help women and babies achieve their goals.
Yes, that is so important, because I know the frustration that a mom feels when breastfeeding is not going the right way.
Absolutely.
And especially when the mom has been so passionate and so committed to doing it, and yet she can't make it happen, and she doesn't have many ideas or information. And so here is where somebody like you can come in, and sometimes with just one little piece of information or one little touch, it makes all the difference in the world.
It does. And in our culture, we isolate our moms postpartum. We don't have that village of moms and aunts and cousins and sisters who are breastfeeding around them. So it's important that they have someone come in and do a personal one. Like you said, sometimes it's just a tweak. It's a little thing here and there, or it's a little diagnostic check of what's going on with their latch. And as you know, babies come out, sometimes they've had a pretty rough ride, and they do need an adjustment or two to correct, the fundamental anatomy and physiology that it takes to suck and swallow and to turn their head properly to get to the nipple. So it's nice to have somebody there. And sometimes moms just need a cheerleader, because breastfeeding is natural, but it's not always innate. And so it's nice to have somebody there that can cheer them on and to assure them that everything is going all right, and to assess the situation and assess the baby and, see how things are going. So, and to unlock that mystery of breastfeeding, if you will.
Yes. Well, we certainly in our practice see a lot of babies that have breastfeeding difficulties, and the part that we can help with is what you were explaining a little bit ago, is that if the baby has had a rough coming out, if they were pulled with forceps or with vacuums or even just with hands, that process of pulling them out sometimes can cause misalignments in their little necks, sometimes in their jaw joints. And so by correcting those misalignments, we're able to restore some of the movement of their neck, which is
Right.
one of the reasons that they could have some breastfeeding difficulties. Sometimes just addressing their TMJ can also create a bigger space when they open their mouth so that they can actually latch properly on the areola and not on the nipple. What I want to hear from you is what other things could be factors in a baby that doesn't latch or that is not breastfeeding appropriately? And what can you tell moms that are going through this right now, some tweaks that they can actually do at home without having to call somebody or going somewhere, especially now that we are all in social isolation?
Absolutely. Besides the asynclitism that we talked about, and sometimes being, having a rough birth, a tongue and lip tie, that is such a huge issue. And luckily we are blessed to have some really great revisionists here in town. But assessing a tongue and lip tie. The other thing too is understanding the anthropology of how babies nurse. Breastfed babies feed very differently than formula-fed babies. So understanding how babies nurse and what is considered normal, and milk supply, how it waxes and wanes with babies' needs, that it's not always the same, volume that you're either going to pump or express. And it's just important that right now in social isolation that, we look for sources that are reputable. I love Facebook groups. I love Instagram groups, but sometimes, some of the information on there may not always be correct. So it's important to reach out to a lactation counselor or an IBCLC at the hospital to make sure that you're getting the correct information. Pediatricians in town, there are many that have CLCs on staff, which is great. So seeking a reputable source of information is really key. I know I've been providing virtual, just like you and I are doing, a virtual breastfeeding counseling session just to kind of go over questions. I can even correct latches, so it's important that if moms are feeling pain, if there's cracking, if there's bleeding, if something is wrong, that we take a look at what's going on. How is the baby latching? And like you said, sometimes it's just an easy little tweak. Sometimes it's a little bit more involved.
Okay. So how would you feel about breaking this down into, if you see this happening, then this is something that you could try. And of course, we are not seeing the baby, not seeing the latch. So
Right.
This is more of a generalized idea, but just to give some tips in case there's a mom out there who's struggling and maybe she can just listen to you and try.
Absolutely. Absolutely. The first thing is nipple pain. If you are noticing that when the baby latches, there is even if it only lasts 20 seconds, if there is a searing pain, we want to look at,
I know that pain.
We all know, all of us kind of went, you curl your toes a little bit, but we want to make sure that the baby's in the right position. And the first thing is that I always, you want to be able to look down and look at your baby and make sure that it's not rolled up onto the breast, that it's coming from low to high. So just adjusting that situation. The second thing is if you have cracking and bleeding, we want to make sure that as your baby relaxes at the end of a feeding, they don't take in the nipple like a straw. You can almost hear it like a little suction sound at the end of the nipple. So we want to make sure that that breast is supported, so it's not a moving target for the baby, and that deep latch maintains through the entire time they're actively nursing. I'm all for comfort nursing, but if you start to notice that the mouth recedes off the areola to the end of the nipple,
right,
we need to break the latch and start again, excuse me. So the other thing is volume.
Kelly, just let me interrupt you for 1 second, because this is a really important point. 33 years ago, when I was nursing my daughter, I had all of these symptoms, and I was just so stubborn and so committed that I was going to do this no matter what, that I just thought this is the way it is and I'm just going to do it no matter what. So I just want moms to know that nursing should never hurt.
Right.
It never should hurt. So
there's a adjustment for sure.
Right.
But nursing should never feel painful. I always explain that the normal adjectives are there's a tug or some tension. You can feel pressure in your breast. You can feel expansion of the nipple. It can be sore. Adjectives that are not good are searing pain, chomping, or clamping down, or needles. Those are really negative adjectives. So if you feel those negative adjectives, there's something wrong. So we really do want to take a look at, do we have a good deep latch? Is the baby positioned correctly on the breast? You know, and a simple thing too to do for that is, if the baby starts to get irritated at the breast and pulls back, we call it niplash. You know, doing a simple breast compression, just giving the breast a gentle squeeze to get that milk to kind of flow just a little bit, can help tremendously. So, you know, they pull back to ask for flow. So if they're expanding the nipple by pulling away from the nipple, they want the milk to flow a little faster. So we can do some good deep breast compressions to help that milk flow on its own, or simply change to the other side.
Okay. Let's talk a little bit about positions.
Okay.
So there's what people normally would assume is the normal position, which is sideways, the baby lying horizontal.
Top cradle.
Yes, thank you. And then a lot of times then you might advise that they have the football hold, which is under the baby's body, under the arm, coming at it the other way. Then there is I think it's called baby-led nursing or biological.
A laid-back position.
So can you talk about that also a little bit?
Sure. Yeah, absolutely. I always recommend the football hold for the first couple of days if a mom has had a belly birth, just because the added tension downward onto the belly scar might be a little painful. So coming up underneath, you still want to make sure that the baby is tummy to tummy and that their little face is looking up at you, not pointed down towards your breast. And the cross cradle is the same way. You really want to make sure that, you know, women have a tendency to hold that baby way up here. Well, they can't elongate the nipple if they're above the nipple. So we want to make sure that that baby's below the breast and coming up with their chin tilted back, just like they're going to drink out of a bottle of water, per se, and then come on to the nipple that way. And then that way they can, if you think about it, we want to elongate the nipple into the mouth. If the baby's above, it's going to drink out of a bent straw. So we want that nipple to be long into the mouth. So think of how that baby has to be. My favorite, I do love the laid back nursing, and that is just where the mom reclines, even just 10 to 15 degrees, like in a recliner or against some pillows, and the baby actually lays down the torso. And so their little tummy is, you know, almost to your rib cage, and their little bottom is on your hip. And and it's very comfortable because everybody's all snuggled up. And again, they're coming up low to high from underneath the breast onto the nipple, elongating that nipple into the mouth, not crunching it. So again, the football hold is really good. And also too, if you have a big baby, that football hold with a little boppy underneath it can be very helpful, because, you know, 8 to 12 pounds after a while gets a little heavy holding it like this.
Right.
So, you know, that underneath is really good. I love them.
Well, that's what we normally call new mommy syndrome, is the syndrome that new moms have because they're constantly holding a baby and looking down at their baby, and hunching over to change diapers and hold. So definitely that is something to think about. If you can sit back and just let your body relax onto pillows and just have the baby suspended on top of a pillow or a boppy, so that your arms are not having to hold the weight of the baby while the baby's nursing.
Exactly. And all you have to do is maintain some, you know, some pressure on the breast while they first latch on, so that's not a moving target. Especially moms who have larger breasts, we really need to make sure that that breast is nice and steady, because, you know, babies they've never had to do this before. We want to give them a hand.
Yeah, I like that moving target idea, because it's true. They're constantly like looking for that.
Oh, they're looking, and then that, you know, they're trying to find that, you know, because their vision is still so limited, but they can see that contrast of the areola, and they know they want to get there. They can smell the milk, They just don't have the fine muscle control and the cerebral maturity to move towards it. They just don't know. So by studying the breast for them, it helps them achieve their goal. Every time they latch is a success. So we want to make sure that we are giving them all the positive reinforcement that we can.
Yes. Let's talk a little bit about nipple shields. And when would you advise a mom to use a nipple shield, and how does it work, and anything that you can tell moms about this?
Well, nipple shields are kind of, they're a tool that we use for when mom's nipples are either inverted and have maybe seen the light of day sometimes. Sometimes they come out a little bit because the first time a baby latches onto an inverted nipple, that's very painful. So I always recommend, as the baby is getting the nipple to engage on its own, a nipple shield is useful for that first, even sometimes even the first 2 weeks with an inverted nipple, until the nipple can come out on its own and stays out, to protect that tender skin. The other time I suggest a nipple shield is when we have a deep crack, just to protect it until it's healing. And also too, when you have babies who are very tiny, or maybe even a little preemie, they can latch onto a nipple shield a whole lot better than they can the bare nipple, because it's firm. And as you know, Dr. Alterman, from working with preemie babies, their suck-swallow reflex is not always that great. So giving them a firm nipple to hold on to, it can help them a little bit better. So, and it's something that we use temporarily. I usually stay with moms for weeks, seeing their progress with nipple shields, because eventually we do want to wean them off. And I've had moms use nipple shields up to 3 months, and then we wean them off. But they're really used as a tool for success when moms have an inverted nipple, or when they have a deep crack, or when your baby's having a little bit of a suck-swallow issue.
Yes. Okay. All right. What else is there that we could bring in for
nipple health? We want to make sure that, especially right now, since we're probably not seeing our physicians, we're trying to diagnose everything else, but it's very important that moms use a really good quality nipple butter. I personally like the Earth Mama line and Mother Love. They're very good. If you don't have that, if you have lanolin or even just simple organic coconut oil to keep, because all of those are antifungal, so we want to make sure we keep thrush at bay. We want to make sure that we're keeping our breasts clean with just warm water, not soap, because we don't want to dry out that tissue. We want to make sure that breasts are staying dry. It's really easy to, as soon as you're done, you put your bra back on and you go on with your day, especially if you have more than one children. But these, we have to make sure that before we put our breasts away, that they're nice and dry, and that they're going into a dry bra or a dry shield. So if you have the nipple shields, make sure they're nice and dry, because thrush can take off on a breast that's even just a little bit abraded, and then you'll get the thrush up into the breast. Babies can get the thrush in the mouth. So we want to make sure that we are really taking care of our nipples, during this, especially since we don't have a resource to reach out to right now to say, hey, does it look normal? Or I've got this pain or whatever. So, keep it clean, keep it dry. If you do end up with a crack, you can use Neosporin in between the feedings. Babies can't have Neosporin, so you need to make sure you wipe that off efficiently, and use a really good quality nipple butter or a high quality lanolin that's preferably organic.
Okay, those are really, really good points. So with everything that's going on with the pandemic, your ability to see moms either as a doula in their birth or as a lactation counselor is now probably mostly virtual.
Yeah, it's almost all virtual. I have labored with a couple of moms at home, getting them to the point of the deepest part of active labor, transferring with them to the hospital, and then kind of tagging out the dad, and then virtually assisting, during the pushing or the receiving of the baby, and then virtually seeing them postpartum. And then all of my breastfeeding appointments have been virtual. We have had to get really creative. I'm using a lot of, Post-it notes and things, little reminders. I've created like a bank of Q&A, you know, if people need that, you know, what can I do kind of things. So yeah, we've had to get creative, you know, we've had to definitely step up our technology game.
Yeah, yeah. So before we say goodbye, are there any last minute advice that you can give out?
Well, the one thing I will say for my new mommies especially is that kind of take this as a little bit of a blessing. I personally love the 40-day, I hate to use the word confinement, but that 40-day, you know, first 40 days of being still with your baby. And we are kind of having to be still with our babies. We're not getting to take them out. And it's such, the silver lining of this is that you do get to have downtime. Your body is healing beautifully. Your milk supply is being established because you're eating and you're hydrating. You're not running yourself ragged. And you're getting to know your baby instead of an app. You know, it's really great that we are afforded this time to be still with our newborns. And so if we can look at one silver lining of all of this is that it is affording moms the quiet time to heal and to learn their babies. It's not easy. You know, I miss my human contact as well, but I keep telling my mommies, you know, look at what you get to do. You know, not that you have to do, but look what you get to do. So I'm trying to put a positive spin on a very, you know, difficult time.
It's interesting that you mentioned this time period of just keeping quiet and staying at home.
Yeah.
I grew up in Colombia, in South America, and I came to the United States when I was 17. But during the time that I was there, I saw how moms that had babies would go into a period called quarantine. And in Spanish and in Latin, the word quarantine means 40. So it was 40 days where moms would just stay at home after they had their babies, and all of the other women in the family would come in to do the things that she wasn't doing. All she did is just to be in bed, nurse, and sleep. That's the job of a mom. And in my young mind at the time, I was thinking, this is the most antiquated idea. How can you force a person to just stay in bed for 40 days? This is ridiculous. Well, fast forward, I don't know, 10 or 15 years when I had my daughter, and I was like, I can do it all. I'm going to go to the office. I can have this baby with me. I'll bring her to the office. I'll nurse her between my patients. And I wore myself out completely. And at that time, I started thinking, you know what, that quarantine doesn't sound like such a bad idea. That is exactly what I would love to be doing right now, instead of being in the office, not having slept more than 2 hours last night, and yet here I am pushing myself like this. But you know, that idea that we are super women and that we can do it all is sometimes we have to just have some humility and realize that it's not all that it's cracked up to be, to do it all.
Well, and it's okay to pause. You know, I try, and one of the things that I teach in my childbirth class is that it's okay. It doesn't make you less of anything, but it makes you more of a mother. And to heal your body, I mean, women go through unbelievable physiological changes when they give birth, you know, whether it's a vaginal birth or a belly birth. We are changed, and that healing, we need to heal. And, you know, in our culture, we don't honor that. And so I'm using this, you know, time of social isolation and forced downtime to encourage moms to look at it as healing and what you get to do. And I also appreciate the tradition that you come from. And so, you know, I keep just encouraging my mommies, you know, eat, sleep, drink, and get to know your baby. You know.
Yes. Well, Kelly, this has been a really wonderful interview. Thank you so much.
Thank you so much for this opportunity. I can talk about breastfeeding all day, so I appreciate the opportunity.
Of course. So for those of you who are watching us, I'm going to put Kelly's information at the end of the video. And as you probably already gathered, Kelly can do virtual help with childbirth, with education, and with breastfeeding.
Yes, ma'am.
Okay,
All right.
excellent.
Thank you so much, Dr. Alterman. We'll see you soon.
Have a great afternoon. Bye-bye.
You too. Thank you.